All righty. I believe that we are about ready to go. All right, so good afternoon, everyone, and thank you for joining us for, what is it, week 5,255, I don't know, of our virtual press conferences here with the City of Roanoke. I'm joined once again with Mayor Lee, Vice Mayor Cobb, and City Manager Bob Cowell. So we're going to go over a little bit about our Phase 3 reopening. So I'm going to turn it over to Mayor Lee. The floor is all yours, sir.
Thank you, Tiffany, and good afternoon to everyone. This week, we want to focus on the city's Phase 3 reopening process and how things are going in our various departments. Since we continued our limited reopening on Monday, we have had a good response from citizens who are assessing city services in person. You have shown a lot of patience, and for that, we are very appreciative. We also appreciate our employees that have come back to the office after teleworking since March, and to those that continue to provide services remotely. Since reopening on June 8th, the Treasurer's Office has had a steady line of customers. Approximately 75 people a day come to the office for transactions such as business license, real estate, and personal property tax payments. The treasurer will be mailing out approximately 20,000 delinquent personal property tax bills. And in August, the treasurer will mail out approximately 28,000 real estate tax statements. The treasurer's office anticipates that these actions will greatly increase transactions for walk-ins in the weeks to come. From the moment it reopened on July 1st, DMV Select experienced a strong response for in-person services. Located in the city treasurer's office, DMV Select has provided services as follows. On July the 1st, there was 257 transactions. On July 2nd, there were 183 transactions. On July 6th, 163 transactions. So to create a more efficient customer service process, adjustments to DMV Select services are being made beginning tomorrow from 8:30 to noon. So again, tomorrow from 8:30 to noon. Also, on June 8th, the Commissioner of the Revenue reopened to the public for walk-in customers. Since that time, approximately 350 customers have been served. There have been about 45 walk-in customers paying state taxes since June 8th. Fortunately, many business and individual customers have been conducting business with staff through online, email, and telephone processes since March 18th, 2020. Located in the Department of Planning, Building, and Development, the Permit Center is steadily working to realign business practices to maintain the transition to primarily digital and phone transactions. Staff continue to troubleshoot and resolve issues and identify technology tools to facilitate customer contacts. Staff is keeping the office density very low by staggering and rotating the in-office hours of permit techs. Now I will bring on the Vice Mayor Joe.
Thank you, Mayor. Social service offices reopened on July 6th on a limited basis for the general public. Staff is still able to provide most of the most of the services via telephone, email, internet, or Dropbox. Staff is reporting that things are running very smoothly. In order to control and direct customers, tables have been positioned prior to the lobby entrance to establish a checkpoint to determine if customers have an appointment or if they are only able to be served in person. Staff at the checkpoint are working behind a shield and are also wearing masks and gloves. Customers are given access to a mask and hand sanitizer at one of 2 hand sanitizing stations by the entrance. Customers who come in and are able to conduct business with the department by phone or online are provided a slip of paper with written instructions and are not permitted to enter the lobby area. At the conclusion of June, there were 10,499 households in the city receiving SNAP, with 21,228 participating members and $3,671,520 in SNAP benefits issued for the month. Also, as June concluded, there are 35,513 eligible Medicaid recipients in the city. Roanoke Parks and Recreation opened summer camps on July 6th. The department is running programs at 4 sites in 3 locations, 1 at Grandin Court Recreation Center, 1 at Preston Recreation Center, and 2 at Eureka Recreation Center. A total of 32 children have registered, and Preston and Eureka have a small waiting list. Only a handful of children registered for Discovery Center and Garden City Rec Center, while Fishburne Mansion didn't have any registrants. Every morning, staff check temperatures of parents and children, as well as using a health survey of all participants to determine the health of the child who is participating. Staff temperatures are also being checked daily. Children and staff are wearing masks and maintaining social distancing as much as possible. Throughout the day, staff is performing facility sanitation tasks and hand washing goes on all day. Children are involved in active games, crafts, and special projects, some inside and some outside. And our libraries partially reopened with curbside service on Monday, and a lot of people are really happy about this. Library staff have been busy, but have told us that things are running very smoothly. Since June 15th, over 3,000 feed and read meals have been picked up curbside. 385 summer reading kits have been picked up, and over 5,000 items have been returned to library book drops. For more information about summer reading programs and other online activities, make sure to visit the Roanoke City Public Library's Facebook page. For the most up-to-date information regarding our Roanoke Star City Strong reopening plan and other city information, visit roanokeva.gov/StarCityStrong, and also make sure to follow us on Facebook, Twitter, Instagram, and Nextdoor. And now I'll turn it back to you, Bob and Tiffany.
Thank you, and I'll thank you, Mayor and Vice Mayor. And I'll add one additional item to the items that the Mayor and the Vice Mayor have already mentioned. As we've released earlier today, I think, as well, is that the Recovery Task Force, which the Council established to provide recommendations for use of the task force recovery revenue that is available, will be conducting a public hearing on the evening of next Tuesday. So on the 14th, beginning at 7 o'clock, the public hearing will be conducted virtually, as has our council meetings been recently. So folks that are interested in joining in that public hearing and participating or offering any comments are encouraged to, or required to, contact the clerk's office so that they can receive the invite information with it. And more information will be sent out over the next day or two out to the media as well as the general public as well. So with that, we will certainly entertain any questions that you all might have regarding the information. And so the first question is coming from Jean on Jean Morano about when the city may open bathrooms and porta johns along the Greenway. Says some of them are running without hydration, as you can imagine, which can be challenging. And it says Salem and Roanoke County never shut down the bathrooms along the parks and greenways as far as they can tell. I will talk with the parks folks. It's been an issue really of just having more staff back in the office. And now that we have more staff back, we may be able to actually open. I know we have opened they've been open actually for a while, the restroom facilities at parks. And so I'll check on those with the greenways. The porta johns we don't actually service. Those are serviced by a private company. So certainly we'll check on those as well. Second is a question regarding, are you considering moving back to phase 2 if cases keep increasing? If so, at what point, and how does that process work? I'll give a part of this answer, and certainly anything that the vice mayor or mayor may want to add. The way that the system is structured right now is as communities move into, or as the governor decides to move into various phases. So when we move from phase 1 to phase 2, and then from phase 2 to phase 3, communities that did not want or did not feel it was appropriate to move into that phase could petition formally the governor for the ability not to move into that phase. You saw that initially in Richmond and a couple of the Northern Virginia communities. And then more recently, everyone, I think, moved into phase 3 together. It's not clear what the process would be, that if you already have moved into a phase and if you wanted to kind of revert back to a phase, though I presume it would be something similar to that in that you would request that information of the governor. I will say that here, and certainly the mayor and vice mayor know, because we've talked about this, that any effort like that here locally in our area really only makes sense if we as a region move in that direction. It doesn't make a lot of sense that the city of Roanoke would do something different in the city of Salem and something different than Roanoke County, for example. And certainly I know all of the administrators and all of the elected officials in those jurisdictions, just like here, are continuing to watch the caseload and interacting with the Department of Health here as well. Mayor, Vice Mayor, I don't know if you have anything you would want to add to that question or to those points.
Well, I concur with your statement, Bob, and let me just say, I think for council, if there's a point where we feel may be better if the numbers continue to spike up, our first and foremost responsibility is public safety. And so I would not be personally, I would not hesitate to go back and request for that, even though, as Bob explained, it's a complicated system to a degree, given that we want, some other people would need to come along with us. But I would, approach Dr. Odell and just share the concern that we have. I just always use that as a measuring stick. Are the citizens or the community in danger with the numbers spiking up?
Yeah, I would just, I agree with the mayor and Bob and just say that, our messaging has been consistent. Our practices have been consistent since this began. We have said wear face coverings, practice social distancing. We've reiterated it over and over again. What's changed is that as some of the restrictions have been lessened, people have, some people in general have decided to stop wearing face coverings, to stop honoring social distancing. And so we're seeing more of this spread take place. And as Dr. Odell has said, many of the increases in cases that we're seeing are due to travel, specifically Myrtle Beach. They're also due to people having parties locally and regionally and not honoring social distance and wearing face coverings. So it's really about each of us as individuals honoring these guidelines that have been set forth from the beginning that we have been very consistent in supporting and encouraging. That's ultimately the only way that this is going to be prevented and reduced. So,
yeah, And I think I would add to the kind of the point of the question about at what point, I think, the key indicators that are being watched all across the country really have to do with the very original reason why we went into these phases, which is dealing with hospitalizations and the ability for the healthcare system to keep up with cases. And so certainly maintaining kind of or watching those numbers in terms of how many admissions into our hospitals are occurring, how much use of the ICUs are happening. Those are going to be even more significant indicators than the number of cases, because as we have all said previously, the objectives here are not necessarily to try to avoid, because it's impossible to have avoiding everyone getting or some folks getting COVID as we go through, even if the steps are taken. It's really to make sure that we can manage those cases as we go through. So I think those indicators would still be used. Ralph asked about the resumption of recreational sports for adults and youth. At what phase is that allowed? Phase 3 actually allowed some of those activities to occur. There are some restrictions, mostly dealing with folks that might be in attendance, so like parents and those types of things, but also separation in terms of while people are in, like dugouts or on the sidelines and stuff. There are those. It is presumed that if and when there's an additional phase, those will be lessened even further. Then those swimming pools are a good example that have some restrictions still that are pretty restrictive as we go in. So, but some of those are permitted currently. Question is the increase of cases impacting certain parts of government-run facilities, and will they remain open at the capacity they are right now? Yes, they are having an impact, as the Vice Mayor mentioned. Even though our libraries, for example, are open for curbside service, they are not yet open for the general public, and we will not open them to the general public until we have reached a point at which we feel like they can safely be done, that those activities can safely occur, having folks in the buildings along with the employees as well. Though we mentioned in this briefing that the recreation centers are currently being used for very limited size summer youth camps, they're not open to the general public right now for the kind of use they typically would. So those government facilities still continue to operate in a different way to try to avoid any further exposures in the area. And then yes, if we indeed did see in any of our facilities reason to be concerned, either have cases occur in the facilities, or if there is something going on in our community, separate and apart from any discussion about phase 2, phase 3, we ourselves in the city could certainly take further actions about city-owned facilities. You're actually seeing that, as the mayor mentioned. DMV will actually adjust their hours tomorrow here in our building. Instead of being open from 8:30 to 4, they're going to be open from 8:30 till noon. And that is in response to the volume of traffic that they were seeing. And they want to try to actually lessen that, to give themselves some more time to actually do some of the work they need to as follow-up associated with it. So I think you'll see those kinds of adjustments go as we continue to monitor what's going on and adapt to whatever the new reality that's in front of us for that day or for that week might be. Are there any other questions? Not seeing anything. Mayor, Vice Mayor, anything that you would like to add about any of these topics, or as we begin to wrap up?
Well, I just want to say I'm pleased to see how this phase reopening has gone thus far. And I'm also keeping a close eye on the numbers. And as the Vice Mayor alluded to, still have to take personal responsibility. That hasn't changed. And I'm concerned that that message hasn't gotten all the way through yet, but we'll keep working and hoping, praying that people will understand that virus is there, and we've got to make sure that we're doing everything possible, and to remember that it's not about ourselves, but it's about others in terms of why you wear the mask and the social distancing. That's so important, personal responsibility. So thank you. Thank Bob, you and the staff for working and doing the things you've done here in the municipal building and the city to go through this reopening, this phase 3. It's a challenge, but I'm proud of the effort and the work that's gone into it thus far.
Yeah, thank you. And yeah, the staff has done a great job with being able to adapt. And actually, I have to say that the customers that have come into the building have been phenomenal. I mean, everyone has been very, very patient. We actually, and Vice Mayor knows because he provided it to us. We got an email from someone who had indicated that they, though they waited 2.5 hours to get their service, they actually said it was probably one of the best experiences that they had because everyone was so pleasant and moving their way through the system. So we've been very pleased with not only how our employees have actually gone about this, but also the folks that have come into the building and are really trying to make all of this work the best that they can. And Ralph was wanting to clarify that the DMV select changes are permanent. I don't know what permanent means anymore, Ralph, but they are starting tomorrow, at least for the foreseeable future, will be that 8:30 till noon kind of time frame. And then we'll monitor, the treasurer will continue to monitor how that's going and then may make further adjustments depending on how that's going as well. Vice Mayor, anything you want to add?
Thank you all for what you're doing. Thank the community for stepping up. And just to echo what the mayor said, I think we all of us, even if we are the most vulnerable in our community, particularly those of us who are not the most vulnerable in our community and the highest risk, we always need to be thinking about those who are. Because what we can do to prevent anyone from contracting this disease is essentially providing safety and health for our greater community. And it's going to get us through this pandemic in a much stronger and healthier way. Thank you.
Yeah, thank you. And I'll just remind everyone again that next Tuesday at 7 o'clock, we have the public hearing for the recovery fund associated with the task force's work, and folks that are interested in that should contact the clerk's office to secure the contact information to be able to join us. So as always, thank you all for joining us and for your questions. Very much appreciated, and hope you have a continued good and safe day as well. So Mayor, Vice Mayor, thank you very much.
Thank you. Reporter friends, if you have any follow-up questions, just shoot me a message and we'll put some information out on social media and our website about the meeting. So you guys have a great night. Bye-bye.
Thank you.